Okay. Okay, so this is Amelia Hill. I am performing my tracheostomy care and trach suctioning check off today. I have my patient here sitting up, kind of. I have my trach set up here. This is a straw, and this is my trach mask. I have hand sanitizer. I have protective eyewear. I have a mask. I have my order, my trach suction kit, my new in-ear cannula. It's just in some paper. And then my trach care kit here. So I get this a little bit more so you can see what I'm doing. Okay, the first thing I'm going to do is I'm going to verify my order. So I have an order today for Pat Chamberlain. Date of birth is 1/2/1962. From Dr. Feelgood to suction trach due to increased secretions. Change any cannula and also change dressing and trach ties. That is my order. So I verified my order, so I'm going to go in the room. I'm going to perform hand hygiene. I'm going into the room. Knock, knock. Hey, Mr. Pat Chamberlain, my name is Amelia. I'm your student nurse today. Dr. Feelgood would like me to perform some trach suctioning on you and also change your in-ear cannula and change your dressing and your trach ties. Is that okay? And can you give me your name and your date of birth? And he's verified his name and his date of birth, and I'm going to provide privacy. Now the reason for this, I will give him the rationale, which is to help alleviate some of the secretions that's in his upper airway. Do you have any questions? So he's okay with me suctioning out this gunk that he has in his lungs, these thick secretions, and he has given me consent to perform this procedure. So first thing I want to do is I'm going to auscultate his lungs. I also may want to also have a pulse ox on his finger. I am going to raise the bed to waist height. I'm going to have him in Fowler's or semi-Fowler's position. I'm going to auscultate his lungs. And he does have some secretions, some bronchi that he has in his upper airway. I'm going to hyperoxygenate him according to the facility policy or protocol. Next, I'm going to perform hand hygiene. I am going to put on my mask. Will show that I'm putting this on, but I'm not actually going to put this on. But I will have this on the entire time. And I also would have protective eyewear on the entire time while performing this. But I'm going to leave that off for now, but I would have that on. Next, I'm going to open up all my supplies. Well, actually, let's go ahead and put this on. We're going to close this back. I'm going to pretend I didn't open it yet. I'm going to put on my protective eyewear. I'm going to see if I can put it on without it fogging up my glasses too bad. Okay, I'm going to have to take these off for now because it's warm in here or something. It's causing me to have off. So I have my protective eyewear and my glasses on. I've done my hand hygiene. So I'm going to open up my sterile suction kit. I'm opening up my in-ear cannula. And I'm going to open up my trach cleaning kit. I'm going to put on my sterile gloves. And I'm just going to touch the inside of the packaging and throw that away. I am going to open up my sterile water tray here. I'm going to pour in some sterile saline, and I'm going to set this to the side because I'm going to use that sterile water again, or sterile saline. I'm going to open my suction tubing up, and I'm going to curl my suction tubing up. Okay. I have my suction tubing in my sterile dominant hand. With my non-dominant hand, I'm going to adjust the suction regulator between 100 and 120 milliliters per mercury pressure. I'm going to turn the regulator on, and I'm going to connect my my suction tubing to the wall suction. Okay. I'm going to, if that happened, I would start back over. But I would take my tubing and moisten the tip. I would remove my mask, and I would insert the suction tubing till I'm at resistance or the patient started coughing. I'm going to pull back about a ½ inch, and then I would start intermittent suctioning, moving the suction tubing around, and I would do this for 10 to 15 seconds. And I would pull out, replace my trach mask. I'm going to clean the suction tubing off. I'm going to give the patient a chance to catch his breath, get some more oxygen in him. Okay, after about 30 seconds, we're going to do it one more time. You doing okay, Mr. Chamberlain? We're going to do this one more time, okay? So I'm going to insert the tubing. I've met some resistance. The patient is coughing. I'm going to start intermittent suctioning again. After about 10 seconds, I'm going to start withdrawing. Okay. And I'm going to disconnect my tubing without touching with my sterile hand. I'm going to discard that. I'm going to remove this end cannula, and I'm going to put in my sterile end cannula. And then with my non-dominant hand, I'm going to reach and remove my old gauze. And I'm going to look for color, odor, consistency, and amount. And it's pretty clean. With my sterile hand, I'm going to pour some more water into my trach kit, my trach cleaning kit. I'm going to take 2 Q-tips and pre-moisten them. I'm going to take 1 Q-tip and clean the stoma one time, toss, and clean underneath the stoma one time and toss. And I'm checking the stoma for, see if the skin is red, dry, and intact, no bleeding, no purulent drainage, and there's none noted. Stoma looks good. And now I can take a gauze as needed and pat dry top, and then pat dry the bottom. And now I can place a new gauze. And at this point, I'm done being sterile, so I can't touch everything. So I will put in a new gauze. And I just cut my trach ties in half and made 2 trach ties. So I do have a second trach tie. I'm gonna try to do this. I would hold the trach, and I'm gonna pull out on this side. Okay. And now my patient, the trach ties is secured. 1 finger breath tightness. I'll put the oxygen mask back on. I'm going to discard my supplies. I would take off my gloves. I'll take off my gloves. Remove my face mask. I would remove my eyewear. I will perform hand hygiene. I'm going to reassess the patient. I'm looking at his oxygen levels. Oxygen is good. I'm going to re-auscultate his lungs. Lung sounds are clear, so I'm going to turn this oxygen back down. So I've cleaned all this up. Now I would lower the bed, lock the bed, side rails up as needed, give him his call light. I'm going to perform hand hygiene. I will reopen his curtain because we provided privacy during this entire procedure to make sure he had his privacy. And now I would document my findings.